Prostate cancer is the second most common cancer in men in Singapore, with thousands of cases diagnosed each year. Well, in this week's feature on Living Well, we discuss why you should get yourself checked. The prostate is a walnut-shaped gland found in the male reproductive system. If abnormal cells in the prostate gland grow too rapidly, a malignant or cancerous lump is formed. Advanced prostate cancer can spread to other parts of the body, like the lymph nodes and bones. Dr. Tan Teck Wei is a consultant urologist at EuroHealth Medical Clinic, and he joins me now. Welcome to The Big Story, Dr. Tan. Are there any symptoms, first of all, that men should be looking out for that could indicate early signs of prostate cancer?
Hi, good afternoon, Olivia. There are some signs, but usually we would say that most of the time in early prostate cancer, men do not have any symptoms. More commonly, because these men are above the age of 50, they do have signs of benign or non-cancerous prostate enlargement. So they may have some urinary difficulties, such as difficulty passing urine, slow urine flow, frequent urination, urgent need to pee, waking up at night to pee. But these symptoms are mainly caused by the prostate enlargement. But because they do present themselves to a doctor, when we check them out, we find them to have early prostate cancer, because by its nature, most of the time early cancer does not grow to a size that leads to any of these urine symptoms.
I guess possibly that leads us to the next question about, regular screenings, because survivors of prostate cancer have told us that screening saved their lives. Can you give us some details about these screenings, and how often should men get checked?
Yeah, so actually routine screening of all men for prostate cancer is a bit controversial. In Singapore, we don't routinely recommend all men to be screened for prostate cancer. There are some reasons for this, which I'll elaborate. But firstly, we would say that if the man is at risk of having prostate cancer, these risk factors are such things as a family history, having a father or brothers or uncles with prostate cancer. These men are at increased risk of prostate cancer. And usually we recommend screening from the age of about 45 and above. Some families have a strong family history, for example, of breast cancer, and therefore this breast cancer gene mutation. So if they're confirmed to have a breast cancer gene mutation in the family, the males in the family are at higher risk of prostate cancer as well. And there's some recommendation to start prostate cancer screening from the age of 40. Well, for the general population, it is not recommended because the risk of finding cancer is lower. And in case your blood test, which is because of screening is usually done through a blood test, although the blood test sounds simple, it is unfortunately not very accurate, and men with elevated blood tests may be subjected to further investigation, some of which can be pretty invasive, like a biopsy. So at this moment in time, we don't strongly recommend screening everyone, but certainly men above the age of 50 years old, if they were to present with some form of urine symptoms, we do counsel them on the pros and cons of screening, and they may want to go for the blood test and be further evaluated for the risk of prostate cancer.
Well, Dr. Tan, another important question to round up this discussion: is prostate cancer curable? And what are some of the treatment options available out there?
I think as with most cancers, prostate cancer is also very curable, especially in its early stages. That means that if the cancer is completely confined within the prostate, there's no evidence of any spread outside the prostate, it is very treatable and usually very curable as well. There are two main forms of treatment for prostate cancer that is localized to the prostate. One is surgery. Surgery means you remove the entire prostate, and after the prostate is removed, you will need to stitch the bladder down to the urine pipe below so that the patient can pee from below as per normal. So this is usually done nowadays with the robot assistance, because it allows us to do the surgery through 6 small 1 cm holes in the belly. Recovery is usually pretty quick. The other alternative treatment option is radiotherapy. Basically, this means that patient doesn't go for surgery. Radiotherapy basically uses very strong X-rays, which is focused on the prostate to kill the cancer cells within the prostate. It is usually not a one-shot procedure. You may need to come back for a few treatments before the radiotherapy is completed, but both options are equally good for the treatment of early prostate cancer.
Well, thank you so much for your time today, Dr. Tan. Dr. Tan Teck Wei, consultant urologist at UroHealth Medical Clinic. Prostate cancer patients like Mr. Clarence Heng have been sharing their stories with the Straits Times, from diagnosis to treatment and how they have regained their health. You'll find their stories at str.sg/livingwell.